Hey guys, I'm Amy. I'm the mom of someone who was medically fragile in the past, now 20 years old, now doing very well. And I wanted so much more information and guidance than I was able to get at the beginning, especially as this was all new. There was no diagnosis and things like that. So I've decided to share some of what I've learned on a regular basis. Step one, make videos that don't freak me out totally, that actually provide some information. Today, so I'm going to start just by speaking to some questions that I see repeatedly on the family groups that I'm part of. Which are golden hair, craniofacial microsomia, hemifacial microsomia, microtia, and other craniofacial support groups that we have um, for families with craniofacial conditions. Okay, so the first thing that I wanted to talk about today is eating, um, especially for newborns with the craniofacial difference. Um, There can be troubles latching, that is making a full seal, um, and sucking because the anatomy inside the mouth is different. And this is true, not only for golden hair, but other craniofacial conditions, cleft palate, etc. So once the docs have made sure that swallowing, that your baby is going to be able to get food into the stomach pathway and not into their airway by swallowing. The next step is to try to get enough sustenance by mouth. This wasn't possible for Laser. That was one of the hardest things ever for me, um, because she really wanted to breastfeed, and I really wanted to breastfeed her, and she could not. The mechanics didn't work. Even with a special nipple. Now, the hospital tried putting a special, giving me a Haberman nipple to try to put on that would assist, that would release milk more easily than and create less work for Laser's mouth. That didn't work, and also didn't work with a bottle. Now, in our case, Laser had um, so much jaw missing that their tongue was in their throat, and um, only tiny bits of liquid could get down there anyway, never enough to be able to sustain and grow, sustain life and grow. So we um, we had to go with an NG tube, which is a small flexible tube that goes up the nose, nasal gastric, NG, nasal gastric. It goes up the nose and down into the stomach. And this works for newborns all the way until it's time to have soft food. Although in some cases, you might be in the situation we were in, which is even when it's time for soft food, there's not going to be enough space for Laser to get food down by chewing and swallowing. Not going to happen. So, since they knew that mechanically the jaw was going to need to be constructed um, so that the tongue could come out of the throat, so that food could go down, they knew that this was long term, and a nasal gastric tube doesn't work. Um, obviously babies eat more and more, and you're not going to give them only what fits in that tiny tube for all of their nutrition the bigger they get. So Laser got a G tube. I'll talk at a different time. There's about 47 chapters or more about G tubes. Um, Long and short of it is that laser got a G tube, and when you get it, it's a permanent port that they put in. There's also J tubes um, that go to the jejunum, J instead of G for gastric, which goes into the stomach. Um, anyway, when they take that tube out later in life, the area just seals right up, and you're done, and you go forward, and that's what happened in our case. Bye bye G tube. Hello eating by mouth. So I'm going to make a bunch of videos about this. I want to talk with parents, of course, and I made one video that way, and it was so lovely. And I don't have the technical skill yet to even make these videos, so I'm going to build up my skill. You'll see me. I'll get through the gate and um, make videos that get better and better, and then we can talk together. We are such resource for each other, so yay. The more we can do that and be, I think, able to be seen, um, a picture's worth 1,000 words, um, then the more resource that we'll be able to be. Okay, that's my hope. Uh, thank you. I'll see you again. Bye.